Hey guys, this is Mugdha Pradhan. I am a functional nutritionist and the founder and CEO of iThrive, and you're watching me on FitTuck. Today we're going to talk about diabetes, specifically signs and symptoms of diabetes that you should not be ignoring. Okay, so before we go to the signs and symptoms, let's just understand what this disease called diabetes is. So diabetes or type 2 diabetes is a label given to you or a diagnosis that's made when your blood sugar levels exceed a certain level. Okay, we are supposed to have a pretty regulated, steady flow of sugar in our bloodstream. Now, if you have blood sugar levels that are higher than that, and when diabetes diagnosis happen, it's usually maybe when your blood sugar is at 300, 350, that's when you get diagnosed with diabetes. Sometimes in some doctors' cases, they diagnose it at much lower levels. How would you know? Without a blood test, how would you know that maybe you are at risk of diabetes, or maybe diabetes is already kind of developing in your bloodstream as a disease? Is you would experience either one or all or a couple of the following symptoms. The first one would be excessive urination. Okay, so what I mean by excessive urination is you will often feel the need to pass urine, and you might not even be passing large volumes of urine. You could, but you might not also. Now, why would this excessive need for urination happen? It's because when there is extra glucose, blood sugar, right? When there is extra sugar floating around in your bloodstream, your body is trying to dump it, because glucose in your bloodstream is highly oxidative. It can cause a lot of oxidative damage. It can damage a lot of your cells. Your body does not want that. It will do two things. One is it will convert it into triglycerides and fat and store it. Second, it will try to dump it out of your body. Now your body is dumping glucose out, so you are urinating a lot. You're losing a lot of body fluid. Because of that, the second symptom that happens to a lot of people with type 2 diabetes is excessive thirst, right? Like, so you could be drinking like liters and liters of water through the day, and you're urinating, you're drinking water, right? So you're always thirsty and you're always passing urine. Just with this one symptom, you end up with the risk of an electrolyte imbalance. You'll end up losing a lot of magnesium. You'll end up with actual chronic dehydration. So your cells are never getting hydrated. You're just passing water through your body to wash off that glucose. So two symptoms that I discussed. The third one is you could have a lot of episodes of what we call as hangriness. Okay, so why does that hangriness happen is people who have dysregulated blood sugar levels, like suddenly there's a glucose spike, that if the blood sugar is dysregulated and then if they go into these hypoglycemic modes where the sugar levels have plummeted in their body, they'll be jittery, their hands will be shaking, and they just can't control their, there's a lot of nervousness and a lot of anxiety that starts building up, because for the body it feels like a threat when there is insufficient glucose in the bloodstream. What else happens? Weight gain does happen. So people often think that they got diabetes because they gained weight. It's the reverse. Usually you have insulin resistance, which leads to elevated blood sugar levels, which starts getting converted to fat for storage, and that fat shows up as weight gain, and that is really what is happening. And sugar cravings, right? So people think they have sugar cravings. This is the irony. Like, a lot of people think they got diabetes because they have a sweet tooth, and they make that I have a sweet tooth part of their personality. In fact, what happens with a lot of people is because they have insulin resistance, and because after a meal, their cells are not receiving the glucose that is supposed to go and create energy, they get signals of that energy deprivation. Now, for our brain, sweet or sugar is the fastest source of energy. So often, it's a mechanism, it's a biofeedback loop that the body is using to say that, okay, I'm energy deprived. While your blood sugar levels are elevated, it's not entering your bloodstream. So a lot of people get triggers for sugar cravings or feel like eating sweet because that insulin resistance is preventing glucose from getting utilized. So you could have excessive sweet cravings if you have insulin resistance, because somewhere there your body is trying to get glucose into its cells. What are the symptoms? Daytime sleepiness. So because of this sugar spike that happens in the body, you could experience a slump, and usually post meal, if you're having sleepiness, if you're feeling slumped, if you're feeling like no energy, if you need caffeine, tea, coffee to kind of get your energy levels up, it's highly likely that you have a blood sugar dysregulation going on in your bloodstream, which could eventually lead to type 2 diabetes. And then fatigue, especially morning fatigue. If you do not have energy to kind of just get going, it's again because of insulin resistance. Blood sugar is not entering your cells, and that's why you're chronically tired. So yeah, if you're struggling with any of these symptoms, it could be a chance that maybe your blood sugars are dysregulated. I would recommend you getting them checked, and not just blood sugar, but also look for like your fasting and postprandial insulin levels. We want your blood sugar levels to be between 82 and 88. We want your fasting insulin levels to be less than 5 and postprandial to be less than 30. Please make sure you're getting these checked frequently if there's a family or genetic history of diabetes. And as long as you're maintaining them here, as long as you're not showing any of the symptoms I mentioned, you should be good. Thank you so much for watching this. This is Mugdha Pradhan on Fit Tak.